Aicardi Syndrome. Aicardi syndrome is a rare neurological disorder characterized by three main features that occur together in most affected individuals. Agenesis or dysgenesis of the brain is absent or undeveloped tissue. Seizures beginning in infancy can develop into epilepsy and become difficult to treat. Chorioretinal lacunae are defects in the retina. Most patients with Aicardi syndrome tend to also have microcephaly or a small head, axial hypotonia, which is decreased muscle tone, and appendicular hypertonia. Aicardi syndrome affects primarily females but can affect men who have Klinefelter syndrome. The reason that Aicardi syndrome is possible in males with Klinefelter syndrome is because they have an extra X chromosome. Aicardi syndrome occurs in 1 in every 105,000 newborns in the United States. The average lifespan of a child with Aicardi syndrome is 8.8 years. The chances of surviving until age 27 is estimated to be 62%, with the oldest living individual being 32. There are many features of Aicardi syndrome, including eye abnormalities, gastrointestinal difficulties, small hands, vascular malformations, and increased incidence of tumors. Children with Aicardi syndrome tend to have a lower growth rate and delayed puberty. Children with Aicardi syndrome tend to have characteristic facial features, including a flat nose, large ears, and sparse eyebrows. What are the symptoms of Aicardi syndrome? There are many symptoms of Aicardi syndrome, including vascular malformations, microcephaly, hypotonia, and hypertonia. Diagnosis for Aicardi syndrome is typically done through eye exams, EEGs, and MRI or CT scan. An electroencephalogram, or an EEG, evaluates the electrical activity of the brain and detects seizure activity. An MRI or CT scan provides detailed anatomical images of the head and brain. Keeping in mind that there is no cure, what are the treatments for Aicardi syndrome? Treatments include neurosurgery, ophthalmology, orthopedics, gastroenterology, physical therapy, speech therapy, and occupational therapy. The cause of Aicardi syndrome is currently unknown, but scientists believe it is probably the result of a mutation on the X chromosome. One of the theories of the cause of Aicardi syndrome lies in skewed X inactivation, which occurs when there is a severe gene mutation in one of the X chromosomes.
Created using Powtoon.